Hi everyone, and thanks for taking the time to listen to this talk about people in Ontario with developmental disabilities, and more specifically, a group that has both a developmental disability and a mental illness. My name is Rob Ballo. I'm an assistant professor at the University of Ontario Institute of Technology. I have a clinical background in physiotherapy, and I teach a course at UOIT called Exploring Mental Health and Developmental Disabilities. My research interest is in the area of developmental disabilities and more specifically their health and health services. In this presentation, I'll go over some of the background on Ontarians with developmental disabilities, and I'll also go over some of the research findings of research that I've been involved in. Before I get started, here are a couple of definitions. So the developmental disability, the definition on this slide says a disability is characterized by significant limitations in cognitive functioning and adaptive functioning. In more layman terms, that means that people with developmental disabilities often will need more help to learn or understand information when compared to others. People with developmental disabilities also need help with some aspects of their daily life. They may need support from others as they go about their work, play, and lives at home. Developmental disabilities are present at birth or they develop before the age of 18. And examples of people who very frequently have developmental disabilities are, for instance, people with Down syndrome or people with autism spectrum disorder. The other definition I have here is mental disorder, and so this is characterized by clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior. And typical examples of mental disorders are things like depression, obsessive compulsive disorders, and schizophrenia. What you will see in this presentation is that a lot of people with developmental disability also have a mental disorder, and this is sometimes called dual diagnosis. Because it can be a little bit confusing what dual diagnosis actually means, throughout this presentation you'll find that I refer to people with a developmental disability and a mental disorder as people that have DD+. So the two research projects that I'll talk about are, one of them is called Healthcare Access Research and Developmental Disabilities, and the acronym for that is HCARD, and then the other research project that I'm involved in is called Developmental Disabilities plus Mental Disorder Needs Assessment, and for short we call that DDNA. Up until recently, a large number of people with developmental disabilities lived in institutions like you can see in the picture that I provide on this slide. So this picture is actually of Huronia Regional Centre, which was Ontario's oldest institution for people with developmental disabilities. It opened in 1876 and it only closed in 2009. At its peak, there were 2,600 residents living there, and as you can see, the living conditions were not great. It was congregate living, and Pierre Burton famously wrote about Huronia in the 1960s, describing the extreme overcrowding and some of the physical and emotional abuse that was taking place. So there was a lot at these institutions, a lot of the people with developmental disabilities there, their health care was looked after by physicians and nurses that were specially trained to look after the population. The process of deinstitutionalization started in Canada in the 1970s, and as these institutions closed, more and more people with developmental disabilities started to live in the community. And this made a huge positive impact in the quality of life of people with developmental disabilities. Living in communities also meant that they started to use the same community services that you and I use, and this includes health services. And one of the reasons I do research is because we are unsure if the community-based health services that people with developmental disabilities are using, whether or not these have been adequate. As I've already mentioned, one of the projects I'm involved in is called HCARD, and that stands for Healthcare Access Research and Developmental Disabilities. In collaboration with the Center for Addiction and Mental Health and using data held at the Institute for Clinical Evaluative Sciences, we created a cohort or a group of people with developmental disabilities. This cohort includes about 66,000 Ontarians with developmental disabilities between the ages of 18 and 64. What we found is that close to half of people with developmental disabilities also were given a diagnosis of mental illness. That is represented by the green part of the pie chart you see on the slide. When we looked even more closely at this DD plus group, we found that they tend to be younger than the general population and they are more likely to live in the poorest income neighborhoods. The HCARD project also found that compared to the general population, persons with a DD plus a mental disorder are more likely to have a chronic disease. On this slide, I'm showing the prevalence of chronic diseases in 3 different groups. The different chronic diseases are diabetes, hypertension, chronic obstructive pulmonary disease, asthma, and congestive heart failure. The red bars show the prevalence of chronic diseases in people that have DD plus a mental disorder. The gray bars are people that have developmental disabilities only, and the striped bars are the general population, or that is to say persons without a developmental disability. And what you see is that the red bars are quite a bit higher than the other bars. So chronic diseases are quite a bit more prevalent among people with DD plus a mental illness. On this slide, I'm showing some other HCARD results. So for instance, HCARD found that people with DD plus a mental disorder use more health services. So for example, they make more visits to physicians, they are hospitalized more often, and they go to the emergency departments more often. This makes sense and is a good thing since they have higher needs for these services. More problematic, though, is our finding that shows that they are more than twice as likely than the general population to return to a hospital soon after they are discharged. This is called a 30-day readmission. There's a couple of reasons why we think this might be happening more in people with DD plus a mental disorder. It could be that there is inadequate discharge planning that happens before they are discharged, or it could be that once they are discharged, there are often not sufficient supports in the community to help them stay out of the hospital. The Ontario government considers hospital readmissions within 30 days of discharge important because it's considered a measure of health system performance. A high rate of readmissions is considered a marker for health system failure, and decreasing the rate is a priority for hospitals across the province. Through the HCARD research, we saw that adults with developmental disabilities have high rates of mental illness. On this slide, I introduce research that looks at an initiative that the Government of Ontario has put in place to try and address the complex needs of this population. The research is called DDNA for short. The DD stands for People with Developmental Disabilities plus Mental Disorders, and the NA stands for Needs Assessment. The research is funded by the Ministry of Community and Social is funded by the Ministry of Community and Social Services, and it's done in collaboration with Surrey Place Centre in Toronto, which is a centre that provides services for people with developmental disabilities and their families. It's also done the research is also done in collaboration with researchers from the University of Calgary and the Centre for Addiction and Mental Health. In 2010, the Government of Ontario created a new occupation called Healthcare Facilitators. The role of healthcare facilitators, or HCFs for short, is to help coordinate services for Ontarians with DD plus a mental disorder, their families, and the agencies that support them. HCFs do this work by building capacity among existing community health care providers and facilitating referrals and linkages to health and social services. Some HCFs also provide direct clinical care. Many of the families and agencies and persons with developmental disabilities plus a mental disorder that contact HCFs do so because they have encountered barriers while trying to navigate available resources in their community. Although there are only 10 HCFs in all of Ontario, the work they do has the potential to decrease the rates of readmissions in people with DD plus a mental disorder. However, there is very little known about who is accessing HCF services. And these are likely people who have the most complex social and health needs. One of the ways the DDNA research is finding out more about this population is by conducting focus groups with healthcare facilitators and also with healthcare facilitator service users. During the focus group discussions with healthcare facilitators, one of the major themes that came out was regarding the nature of the complexity of care required by people with DD plus mental disorder. The quote from one of the healthcare facilitators on this slide says, "We had someone who would just spend his whole day banging his head against the wall. When he was in community, all of the dental care and foot care was challenging and it was just kind of dropped. 6 months later, he had that ingrown toenail and teeth that were cracking. That's why he was spending so much time banging his head against the wall." This quote brings to light many issues around the health and health service provided for this population. First of all, a behavior problem, head banging in this case, might have been attributed to a mental illness that is actually due to physical problems. And in this case, the physical problems are the teeth and toe problems. And so this misdiagnosis, saying that a behavior problem is due to a mental illness, when in fact it's due to a physical problem, it actually happens a lot. Secondly, this quote brings to light some of the lack of training that is happening amongst clinicians in the community, because these physical problems are being missed and the real source of the problem behavior is being missed also. Thirdly, what appears to be a complex situation is actually caused by simple physical health issues that could have been prevented if proper supports were in place. In conclusion, I hope that you find after this short presentation that the HCARD and DDNA research is addressing the lack of data and understanding about Ontarians with DD plus and their families. The ultimate goal, of course, is to improve their health and social services. Thanks again for taking the time to listen to this presentation, and I hope that you will take some time now to access some of the other resources that are in this module.